So what happens that you get tooth pain? Let's look at the anatomy of the tooth. We will have the enamel on the outer layer, then we have dentine, and here is basically the pulp chamber and the nerve and the root canals. Inside each canal you will have your nerves, depending on how many roots and how many canals there are. Now, when you get a dental cavity, usually it starts from these little pits and fissures, or from the side of the tooth where you do not floss. So food gets stuck here between this tooth and the next tooth because you do not floss for a very, very long time, and here's the gum, for example, food's here, and it starts a cavity because bacteria will use that food as their source of energy and produce acid. Acid will ruin and erode the enamel. Here's a cavity. The cavity inside the enamel usually doesn't hurt you. Some people are more sensitive and they might feel sensitivity when they have sweets. That's the first sign of something being wrong. There would be a cavity there. Now, usually these kind of cavities maybe can be found by a visual examination by your dentist or hygienist. But the ones that are on the side can only be found by x-rays, usually, rarely with eyes, unless they completely break the surface. What happens after that is that these cavities start accumulating inside the dentine, the second layer of the tooth. Here, probably you will start feeling pain because here you would have some nerve endings. Now, these cavities go more and more. If you don't feel pain, or if you do and you don't care about it, you're like, oh yeah, I just eat with the other side. They keep growing, and this is the point of no return. Now, right here, once you have a cavity, if it hurts you or not, you might say, oh, but it's fine, you know, I just eat the other side. That keeps growing. Eventually, it gets so close to the nerve of your tooth, which is right here, or completely invades the nerve of the tooth, that you will have then pulpitis, which is the very painful stage. Because see, the chamber is a closed space. The nerve in it is now invaded by bacteria. The nerve wants to defend itself, so it creates inflammation, and inflamed nerve will hurt. And that's basically the physiology of pain in your tooth. Now, at this stage, when it's inside the nerve and it has invaded and infected the nerve, there's a very good chance that you need a root canal treatment, not a filling anymore. That is why if you have dental pain, or even if you don't, it's best to check with your dentist or oral hygienist every 6 months to make sure if there is a little cavity right there or here, you stop it before it reaches all 3 layers of your teeth. Now, how would you feel it? How would you feel the pain? So the first sign, as I said, when the cavity is smaller, you might feel sensitivity to sweet. Sensitivity to sweet always means there is a cavity. Whether the dentist can find it or not, you should have it under supervision until something is found. Second sign, especially when the cavity gets into the dentine, which is the second layer of the tooth, would be sensitivity to cold. And then it becomes sensitivity to hot when it gets closer to the nerve. Eventually, it will be sensitivity to cold, hot, pressure, and nothing, like no stimulus. You are just not eating and have pain, or you go to bed especially and have pain. That's bad, because when you go to bed, you lie down and all the blood will rush into your head. So here you will have more blood and you would feel the pain more. Usually people say, oh, it's throbbing, it's like it has a heart. That's all because that the nerve is now damaged and inflamed and you're feeling that tooth more. What happens if you don't treat it? Let's say that due to any reason you cannot get treatment for that tooth, that area becomes infected, the infection goes down through the nerve, and eventually you're potentially going to have an abscess right here. Once the infection moves through the canals, it goes to your bone, and it can create a cyst, which is basically an enclosed space. It's like a sac of infection. Now, what's the dangerous part about that? Whether you now have pain or not, you might not have pain because the tooth is completely dead. You just have an abscess, or you might not even feel that. But what is the bad part about that? What's going to happen when there is a cyst or there is an infection? That infection can travel through spaces that we have between muscles and our skin. These spaces are all interconnected, so potentially it can travel through these spaces toward your mediastinum. And that will be dangerous because it can cause heart and sometimes brain damages.
from a single cavity.